And staying on health matters, but on a more positive note, the newest physician in Israel to receive a full professorship, this at the Tel Aviv University, has a number of distinctions. For one at age 35, he is the youngest to receive that honor. Also, his field of specialty is rheumatology. It's not a branch of medicine we normally associate with youth. And he's an Israeli Arab, hailing from the village of Jat in the north of the country. Joining us is Professor Abdulla Watad, Deputy of Internal Medicine B and the Rheumatology Unit at the Sheba Medical Center in Ramat Gan. But he joins us this evening from London. Professor Watad, thanks for joining us. First of all, how does someone at age 35, and you look a good 10 years younger, how does one get a full professorship at that age?
Hello. So first of all, good evening to you and all the people watching us, and thank you very much for having me here. To be fair, lots of work. I mean, I've been working on this for the last 10 years in terms of research, and the key of the game is collaboration, networking, and hard work.
Right. Now, let's talk a little bit about your background. You come from the Israeli Arab community, and certainly those in the country know that the Israeli Arab presence within the medical community in many facets is quite notable. But many of our foreign viewers may not know that and may not know the reasons for that. So talk about your own experience and how that relates to that.
So yes, there are. I would say the percentage of Arabs who work in the medical field, it's pretty high. To be fair, we look at it as something where we can really contribute to the society in Israel, and people might find lots of satisfaction by helping people and treating them. I think this is the reason behind that.
Right. Let me ask you, rheumatology, as I said, and I know there are some young people who experience rheumatitis and other things, but you don't necessarily associate that with young people, of which you're one. What drew you to that particular branch of medicine?
So rheumatology is a very wide field where it's not necessarily, I mean, most of the diseases are affecting young people. And I specifically deal with spondyloarthritis, which are diseases that with involvement of the spine, and such as psoriatic arthritis and ankylosing spondylitis. And I personally, I deal with most of the rheumatic disease as a clinician, but as a researcher, most of my research focused on spondyloarthritis. And I'm doing this in Sheba, and we collaborate with one of the centers of excellence in Leeds in the UK, trying to better understand the reason behind of these diseases is spondyloarthritis.
Right. You have an association with Leeds, I understand. Also, educationally, let's talk about the Israeli health system as compared to those in other countries. Of course, Britain is quite famous with its NHS. I mean, how do you see it as an Israeli medical professional stacking up to those abroad, especially that in the UK?
I would say I found both countries with very high level of medicine to be. I mean, the people can find a very high level of medicine. The only thing that nowadays we're facing lots of crowded emergency rooms, and the hospitals are fully crowded. And this is probably because of the winter and the increase of the number of population. And it's very hard to deal with these things, and there's a need for a couple of years in order to find solution for this. I think both countries are facing the same thing, but still we're trying to maintain a high level of medicine, of therapy that can be offered to most of the patients. And if I look at rheumatology, I think both countries have most of the biologic treatment that these patients need.
Right. Now, let's be honest, not every young professional, a medical professional becomes a professor at all, never mind one that becomes one at 35. What do you say to other young people, and I'm sure you're asked this, including in your own community, about whether medicine is a field that they should be going into here in Israel?
I think people, when they finish their medical study, they have to think deeply of what they really want to do for the next 50 years. And I think that they have the key of the game is to find a good tutor, which in my case is Professor Amital, Professor Shenfield, and Professor Dennis McGonigal in Leeds. And in medicine, you don't have to be genius. In medicine, you need to work hard. You need to keep asking the right questions. You need to discuss all of the questions with the expert in the field. And this is how you can become leader in the field. Keep looking, keep reading, and keep working hard.
All right. Well, Dr. and Professor Abdulla Watad, thanks for joining us on i24 News.
Thank you very much for having me. Thank you very much.